Dr. Michael Barnes here, board certified psychiatrist. Today we're going to go over my algorithm as it pertains to bipolar disorder. This is a really good question that was in the comments, so let's go. First thing I'm trying to figure out as a psychiatrist is the person in a manic or depressed episode. So when you think about bipolar disorder, the first question is there mania and is there depression? And sometimes there can be both, and you could actually be in a mixed state also. So, which by the way, a lot of the anti-epileptics have been studied in. If somebody is manic, I ask another question to myself, which is there psychosis or no psychosis? Okay. Now, if somebody, and psychosis is defined as, auditory, visual hallucinations or similar. It could be delusional thinking, paranoia, and other kind of symptoms that can fall into this category. So if they do have that, I think most people would agree that you do need an antipsychotic of some sort. Antipsychotic of some sort here to treat the psychosis, and that those are obviously highly extensively studied to do that. Now, if there's no psychosis, you can get away with using an anti-epileptic, which are the anti-seizure medications. Remember, guys, every medication that goes to the brain, psychiatry has tried to study. This is an example of that. It was natural of us to kind of study anti-seizure medications. We did that. It turns out many of them are good for mood. So in this scenario, very often, I'll think of meds like lamotrigine or similar. Now, if there's depression, but this is an interesting point that a lot of folks don't know. There is really only a few FDA-approved medications for bipolar depression. So we'll go over them. The first one, and let me get a different color, just to kind of highlight it here. The first one was a mixture of two medications, actually. It was a mixture of Zyprexa and Prozac. Contrary to popular belief that you could use an SSRI, you can't use an SSRI in bipolar, when actually you can. What they mean by that is you just need a good mood stabilizing agent with it. So that's a thing. Then there is Seroquel, technically the XR variation, okay, that has the bipolar depression indication. Then there is Latuda, also called Lorazepam. Seroquel, also called quetiapine. And then there's Vraylar, also called cariprazine. And then there's Caplyta, which is the newest one that got it. Caplyta, also called lamatoperone. So this is a little bit of a glimpse into my algorithm. Hit me up in the comments.